Good afternoon. My name is Jacqueline Trevino and I'm with the Hidalgo County Public Affairs Office. Welcome to today's Facebook Live event. At this time, I'd like to introduce Hidalgo County Judge Richard F. Cortez.
Thank you. Good afternoon, everyone. My name is Richard F. Cortez, and I come to you not only as Hidalgo County's judge, but as your neighbor. Several months ago, I warned the community that unless we took the necessary precautions, that a necessary tsunami would overtake our community. I'm here to say that despite valiant efforts on multiple fronts, the community overall has not taken this virus seriously. In short, the tsunami is here. Today, for example, we're expecting to report more than 1,270 new cases of positive COVID-19 in Hidalgo County. I repeat, 1,270 new cases of positive COVID-19 in Hidalgo County. Unfortunately, with an additional 10 fatalities from COVID-19 related complications. For months now, we have been providing information about how many new people have become infected with this virus. For months now, we have been telling you how to protect yourself from this deadly disease, namely to stay home and to avoid other people. For months now, the community has not followed the warnings of these experts. Neighbors are dying. Hospitals are at capacity. The rate of infection continues to rise. Yet our streets are full of activity, and I get reports from all over the county that people are not taking this disease seriously. So we wanted to bring to our county medical experts and our emergency response experts to share with you today how things stand. The Commissioners Court had an emergency meeting this morning to help secure resources. We are getting help from the state and federal levels. So the situation is dire, but it's not hopeless. So first, I would like to turn it over to our healthcare director, Mr. Eddie Olivares. Eddie.
Thank you, Judge. Good afternoon, everyone. Eddie Olivares, Chief Administrative Officer for Hidalgo County Health and Human Services. It's today with a heavy heart I come to you to discuss something that is very, very important in our community. As Judge Cortez explained, today we're going to report 1,274 cases, new cases of COVID in Hidalgo County. We have reported 10 fatalities, and as we speak right now, we are working on some additional reports that are coming in. The reality is, why do we get here and how did it get here? Judge Cortez explained that there's been plenty of opportunity for our community to take an active role in taking direct responsibility for keeping this virus at bay. However, there's been a lot of additional things that have happened, positive things, good things. We've asked for a lot of testing. We got testing. Here in Hidalgo County, in the last 14 days, there's been upwards of 7,500 tests that have been done by military. Yesterday, there was 3,173 tests done by the federal agencies. And that is not including the thousands and thousands of tests UTRGV has done, along with the private sector. But as we do more testing, we're discovering more and more cases, as evident by today, 1,274 cases. We also have problems in our hospitals. As of right now, we have 741 confirmed COVID patients in our Hidalgo County hospitals, with 194 in ICU. So the message is clear. If you have tested positive for COVID, stay home. Stay home. You must adhere to the fact that this is a national emergency. Stay home. If people in your family members in your household are ill and you're a positive and they're ill with similar symptoms, stay home. This is a very important. The majority of the fatalities we've had, 103 fatalities totals so far, plus whatever we have today will be upward of 120 by the end of the day. The majority of those are elderly, our grandparents, aunts, uncles, our parents. And many times those people were infected, those family members were infected by younger members of the family who are minimal symptoms or asymptomatic. So please wear your mask, your facial cover, wash your hands, social distancing. Do not go out if you do not need to go out. Thank you, Judge.
At this time, I'd like to introduce to you Dr. Melendez.
Thank you for the opportunity once again to reach out to our community. As you all know, my name is Ivan Melendez. I'm the Health Authority for the County of Hidalgo. That's a position that is responsible for being the liaison between our community, our physicians and healthcare partners, our health department, and state and federal medical experts. My responsibility, which I take wholeheartedly, is to serve to the community as a source of evidence-based medicine, free of politics, and backed by scientific truth. I'd like to start by thanking the judge and the commissioners for always being receptive to the recommendations that I have made after thorough consultation with our other local experts, including the intensivists, the multi-specialties, and the primary care physicians in the community. My message to you today is to give you a very quick, a very brief oversight of where we are medically in Hidalgo County currently. As you know, our first case was March 21st. So we're 3.5, almost 4 months into this pandemia. As you'll hear other speakers, including the judge and our Honorable Health and Human Service Director, local health director, Eddie Olivares, we're in a dire situation. After participating in the 1980s in the first HIV wards across the country where we would have to wear spacesuits, after participating as a flight surgeon in Afghanistan and Iraq, and working in the emergency department of the Green Zone, after being exposed to all these experiences in my 36 years, I regret to inform you that when I walk into the COVID wards in our current hospitals, I get the similar, if not worse, more dire depression, anxiety of how dire our current situation is. If all of you had the opportunity to walk into our hospitals, you would see warehouses of human beings, if you will, on stretchers and on ventilators, one right after the other, after the other, after the other. Last 2 weeks ago, when I was still able to participate as an active clinician instead of being sequestered at home, we were asking for one of our nurse heroes, Rory Guerrero, been working with us for 40 years. And unfortunately, she, like 4 other nurses, had passed on in view to the direct contact with the COVID viruses. We currently have, that I know of, 6 physicians that are actively sequestered at home, all of us, including myself, obtaining this virus from taking care of patients. I don't have to tell you that before we were practicing what has worked, social distancing, face masks, appropriate hygiene, our numbers had nadir, had dropped to double-digit 9, 11 patients in the hospital, 3 in the ICU, 1 ventilator, 8 to 11 people, new cases a day, 2.5, 3% positive cases. Today, the only thing that has changed since May 1st is our disregard for social isolation, as was clearly manifested this past 4th of July weekend by our community. What is the result? From single-digit numbers in the hospitals to over 700. From 3 people in the ICU to over 200. It took us 3 months to get to 12 fatalities. Now we're having 15, 17 people die every day. It took us 3 months to get to 12 people. Now every day we have more than that. And we expect for that to continue. What has changed? The only thing that has changed is that we're no longer following social distancing. Nothing else has changed. From a pre-hospital perspective, from a pre-getting sick perspective on a time frame, today's current status reflects what we have not been doing that was clearly working before. From the pre-hospital status of our primary care physicians, I'm very optimistic and happy to report that we are partnering with them. That is, the health department, ourselves, the primary care physicians have formed coalitions where they've established treatment protocols to keep you out of the hospital. Our reporting from the private practitioners' offices have improved. People's adherence to PPEs and physicians' offices has improved. Our treatment protocols have improved. From a hospital perspective, the collaborative effort from what at times had become a competitive relationship between the hospitals and the providers has become, because of our dire need, an extremely collaborative, healthy, and cooperative relationship in between our administrators, our different hospitals, the physicians, outpatient, inpatient, the subspecialist, and the subsequent aftercare. The treatment protocols that are currently available if you do get sick are dramatically better than they were 3.5 months ago. Our treatment plans have now become more uniform based on these 4 to 5 months in other places and our 3.5 months in treatment once you're in the hospital. This is not the format to talk about those 7 or 8 tools that we now have that we did not have before. The collaborative effort that our health department, led by Mr. Olivares, has been able to achieve by obtaining state decision makers, both from an emergency response perspective, as well as from a hospital perspective, supply perspective, et cetera, has been outstanding. We have been blessed with the availability of more resources, the most important being human resources. As you know, we've had thousands of nurses that have been assigned to our area. As you know, or you may not know, 40% of all the nurses that the state has been able to obtain for us or obtain in the state through private staffing agencies, 40%, that's almost half of them, have been assigned to the Rio Grande Valley. Our abilities in ventilators, as reported by administrators, are of course at times in danger, but in general have been available. They tend to vary, but have been available. Our supplies, manifested by the availability of intervention through Mr. Olivares' office and obtaining reagents from local labs and for us has improved. So if you look at mitigation pre-hospital, treatment in the offices, treatment in the hospitals, collaborative effort from all the stakeholders, coming together of treatment protocols, then this is a happy story. This is a forward movement. This is a great moment of optimism. If you look at the human spirit, we have always been able to come back and say, this is what we need to do. Turn off the lights when they're bombing. Ration when our soldiers need what we need. We have failed, unfortunately, at this point in one, and unfortunately, most important aspect of all, and that is the community's adherence to what we absolutely know works. As your county health authority, I'd like to just leave you with this message. First of all, we're leaps and bounds ahead in treatment. Secondly, even though the mortality rate is decreased, more people are dying. Third, I can assure you that this is such a complex system, but I've been blessed to be a part of it, and I can see 50 moving pieces at the same time being led to a positive goal. And lastly, which is the most important message I'd like to leave with you, we cannot prevail without the community adhering ad nauseum to stay away from each other as much as possible. 3 cases this week, child infected both parents dead. My own personal patients. Dr. Melendez at home for 2 weeks, my own personal story. These are dire times, folks. This is not a conspiracy theory. This is the absolute truth. Thank you.
Doctor, thank you. Thank you very much for those words of wisdom. There's some misinformation and some confusion as to what controls are in place today and who's responsible to enforce them, and et cetera. So for the next 2 presenters, we're going to be discussing those items. We're going to start with Commissioner Cortez, who will talk about the controls that are in place today. Commissioner?
Yes, thank you for the opportunity to be here today. Good afternoon, Hidalgo County citizens and residents, municipality leaders of Hidalgo County. We truly are asking for your support with Executive Order GA 29 that was issued on Thursday of last week, July 2nd. Governor Abbott's Executive Order GA 29 superseded prior county orders related to face covering and outdoor gatherings. He mandated a couple of things that include that every person in your city, and for that matter, the County of Hidalgo, shall wear a face covering over their nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor public space. In addition, the governor also stated that people shall not be in groups larger than 10 and shall maintain 6 feet of social distancing from those not in their group or household. And he also said that any outdoor gathering in excess of 10 people is prohibited, unless, of course, there is one, the mayor of the city in which the gathering is held has given permission, or the county judge in the case of a gathering in an unincorporated area has granted permission. Fortunately, the cities, by the governor's order, have now been provided more local and city control, not only as it relates to outdoor gatherings in their city jurisdiction, but also for enforcing facial covering within their jurisdiction. We all understand that no law enforcement or other official may detain, arrest, or confine in jail any person for violation of the order. However, law enforcement may enforce trespassing laws and remove violators at the request of a business establishment or other property owner. The governor also said and made it clear that the cities can do their part in protecting the health and safety of our county citizens. The governor has authorized local law enforcement and officials to act as stated in his order shall be enforced by issuing either a verbal or written warning for the first time violation of a facial covering. A person's second violation shall be punishable by fine not to exceed $250. And each violation after that shall be punishable by a fine not to exceed $250 per violation. And law enforcement also has the authority to shut down any outdoor gathering which was not approved by the city's mayors and/or exempt by the governor's order. Again, we ask our citizens and our municipality leaders to help us enforce the executive order issued on Thursday, July 2nd, GA 29.
Commissioner, thank you very much for that excellent report of where we are. As you know, that on May the 1st, Governor Abbott basically took control of the state of Texas with respect to any orders, emergency orders dealing with this pandemic, and took away, the powers of the county judges and the mayors from different municipalities. I'd like to now pass it over to our sheriff and our district attorney to talk a little bit about enforcement. I mean, we are a county of 22 cities, which represent about 2/3 of the population, and in a rural area that represents about 1/3 of the population. So enforcement is the split division between the county and the different municipalities. And here to speak about both of those is our Sheriff Guerra and our DA, Ricardo Rodriguez.
Good
Sheriff.
afternoon. Thank you, Judge. Again, I'm Sheriff Eddie Guerra, Sheriff of Hidalgo County. You just heard Commissioner Torres give some of the highlights of the governor's order, Executive Order 29 that he issued back in July 2nd. You heard her state that the governor now requires all individuals that are out in public to wear some type of a facial covering, and we ask that you abide by these orders. On the enforcement part of this, the order states that if you're caught not wearing a facial covering, you will be issued a written warning for the first-time violation, and if we catch you this subsequently, you will be subject to a fine of $250. Also, what we're doing, if you test positive for COVID, my office, along with the constable's office and some of the police departments in this county, are serving those individuals what we are known as control orders, basically telling you that you must stay at home and quarantine yourself. However, due to now, you just heard the judge say we're probably going to show our biggest increase in one day with over 1,200 today. Obviously, it's a big challenge for the sheriff's office and all these other law enforcement entities to serve these control orders. If you're caught violating these orders, you will be subject to additional criminal penalties if you are caught out and about. So I'm asking the citizens of this county to heed the words of our local medical authority, Dr. Melendez. The only way that we can combat this pandemic is just to stay away from each other. So thank you, Judge.
DA, please unmute yourself.
Sorry about that. Judge, thank you for having us, and to everyone else who's present. Thank you for everything that you're doing in regards to all county officials, our county commissioners, personnel that have been doing everything that they can to protect the citizens of the county of Hidalgo. It's a difficult task during this pandemic, as you heard, Dr. Melendez, talk about the numbers and the important lives, that this county has lost because of this pandemic. And when we talk about enforcement, we should be the ones, as citizens, doing our own enforcement, because obviously you've heard the number of positive cases, but more importantly, the number of lives that have been lost. And that should trigger everyone doing their part in making sure that we protect not only our family members, but the community, the citizens of Hidalgo County. And Judge, you are correct that, based on the orders that the governor has set out, I know that you and the commissioners and everyone else are trying to do everything that you can to enforce and work with what you have as to the orders. And when the sheriff talked about, that there could be criminal consequences if one test is positive and they're served with these orders and they don't follow these orders, there could be criminal consequences, again, under 81.087 of the health code. Health and Safety Code. But also I want to add that there are other counties and there's other municipalities, not only Hidalgo County, but all over throughout the state of Texas, that are also enforcing under Penal Code 2205, you know, what they're saying is if someone knows that they've tested positive and subsequently to testing positive, we know that they have to isolate themselves, which we've been stressing since day one, and until they receive a negative result. If they don't do this, if they don't isolate themselves, then one could face criminal charges under 22.05 and be charged with deadly conduct. And that reads as follows: a person commits an offense if he or she recklessly engages in conduct that places another in imminent danger of serious bodily injury. There have been individuals that have been charged and arrested in other counties. Again, the message today is not that we want to do that. The message today is, if I can speak, you know, as to the other law enforcement agencies, we don't want to do that. What we're asking the citizens is to adhere to the rules and to the orders that have been set, and no one should be charged criminally. But this does exist, and we want the citizens to understand that there could be criminal consequences if we're not following the orders, or we're placing someone reckless by being reckless in some imminent danger. So I'm asking the citizens of Hidalgo County to please do your part. Let's do our part in protecting the citizens. You know, I want to make it very clear. In protecting lives, I don't care who's Republican, I don't care who's Democrat, I don't care who's independent. A life is a life. You know, I have Republican friends that I love dearly, and I would do anything to protect them any day, as well as Democrats or anyone else. And it doesn't matter what color of skin they are or they have, but you know, we're going to do everything we can to try to protect everyone across the board as fair as we can. And I hope that everybody joins in and telling their family members and their friends, hey, there could be consequences. Forget about the criminal consequences. There's live consequences in the sense that someone could die if we don't, you know, protect ourselves and adhere to these orders. So again, Judge, thank you for letting us be on with all of you and with the citizens of Hidalgo County. We will continue to do what we can to do our part in making sure that we keep the citizens safe. And again, I want to thank Edo Olivares from the Health and Human Services, Ricardo Saldaña from Emergency Management, again, the commissioners, and Dr. Melendez for keeping us informed and trying to protect us as well. So thank you, and God bless Hidalgo County.
Thank you, Councilor, Mr. DA. As you all know, we've been approached by the hospitals. They wanted to inform us of the real seriousness of the emergency that they're experiencing in the various hospitals that we find in Hidalgo County. And as a result of those meetings, basically their needs are as follows. They're having patients already with COVID-related situations that are now ready to be moved out. They're not quite ready to go home. They still need some convalescent. They still need some services. Some of them need even dialysis services. So there's a facility, a convalescent facility that is necessary for them to move patients out of the hospital to make room for new patients. And that was one of the requests that they have. In addition to that, the acute care portion of the need is already at capacity. You heard that we have 741 patients in the hospitals today and 194 in ICU. Those are huge numbers compared to where they were on May 1st, when the governor, took over the direction of what we were doing. So we're looking into possibly an alternative care site, and that could come in many different ways. We're working with the federal government, the federal government to possibly, bring, a field hospital here, or we're working ourselves to see if we can develop one with some additional contractors. As part of our meeting today, we did hear from some contractors that are in the business of doing that. And the good news is that we can get it done. The bad news always is that it's always a costly amount of money. In addition to the need of those two facilities, they talk to the great need of really supplies, particularly oxygen. Oxygen is a very short supply now. The vents, filters, very short supply. So you'll hear from Chief Saldana in a minute about our efforts to try to seek those supplies for them. And then, of course, they need staffing. Everyone now is needing RNs, LVNs, CNAs, pharmacy, radiology, respiratory technicians. They're all are working overtime. They're tired. Some have been inflicted themselves with the disease. So staffing is a huge problem. As you know, a couple of weeks ago, because of that situation, part of our effort in Hidalgo County was to request from the state that help. And we want to thank the governor and thank the state of Texas for sending us those nurses. I don't know what we would have done, without them. An additional problem that was brought to our attention was the need for for transportation. I mean, right now our 911 ambulance services are overworked, overwhelmed also. We need more transportation to be able to move patients in and out of hospitals. So we're working with that. So the Commissioner's Court met today, and we are going to take action. We are going to help. We are going to help in every way that we can. We are obviously trying to find the best way to finance these things. There's not only CARES Acts that could be available, but some of this expenses that we're going to be incurring may also be reimbursable under the FEMA rules. So we want the public to know that these are difficult times. It's not easy to overnight or in 1 week, create a facility that meets all the requirements of the state and has all of the staffing necessary. I mean, we need, cooks, we need, food service, we need laundry service. It's a complicated thing, but we're working on this thing. And I want the public to know that the county and the county commissioners, along with the county judge, are 100% committed to helping the hospitals with this very serious situation. I'd like to now turn it over to our Chief Saldana, who is our emergency manager for Hidalgo County, to give us just a very brief overview of where he's at with some of these requests. Chief?
Thank you, Judge. Ricardo Saldana, Emergency Management Coordinator for Hidalgo County, under the County Judge's Office, Richard Cortez. As the judge mentioned, there has been many requests from the local hospitals and municipalities for assistance at their hospitals. They have been providing us with data that we have created state of Texas assistant requests to get personnel and medical equipment down here. There's been a request for our region of over 2,500 medical personnel. 1,000 of those have been filled in our region. Ventilators, heart monitors, HEPA filters, all those necessary equipment have been requested. We're getting them in limited amounts, but we're receiving some equipment. And on a daily basis, we push up STAR requests to the state for approval. We also have an ambulance strike team assigned to Hidalgo County, which is 10 ambulances, 22 medics, and 2 supervisors. And we're currently working with them. They were extended another 10 days till July the 19th. That is part of the solution to some of our transportation issues. But as they leave, we are currently working with a lot of the local transport companies to hopefully they can come on board and support us with the 911 calls and also transporting some of those patients from the hospital to a transition center. Those are the current topics that we're currently working with the hospital preparedness group and the track here in the region to make those things happen. Judge?
Chief, thank you very much. Lastly, I want to ask Commissioner Cantu to give us an overview of how the Hidalgo County Commissioners Court decided to allocate the different funds that we received from the CARES Act of funding. As you well know, when we received them back then, it was rushed by the federal government. They wanted to get it into the hands of the large counties and the large municipalities, because that's where basically a lot of the density of the problems were. We were unsure as to exactly what we could use it for. We weren't sure as to what we were going to keep. So we were very cautious in not spending anything until we had a very clear understanding of where we could use those funds. So I'd like to turn it over to Commissioner Cantu so he can give us a report as to how and what amounts we allocated our funds that we received in Hidalgo County. Commissioner?
Thank you, Judge. I'm watching the comments on the Facebook Live, and I wanted to clarify something. Back in March, April, when we made the decision here locally to shut down our community, we had that authority. We were given that authority by the governor back then, and we were able to shut down the county. We don't have that authority. So even if we were to make a decision right now to shut down the county, we cannot enforce that. So until the governor gives us authority again, we're not able to do that. So we appreciate your comments. Please keep sending them in. We want to know what you think. We want to know what you see. But the only thing we can do right now is look out for our individual self. And if we're parents, we can look out for our kids, and we could tell them to stay home and be safe. Now, like the judge said, back in April, we were sent $151 million of CARES monies. That money was very restricted. And since then, what we've done is we've allocated some of the money to the cities, and we've also started to buy PPE, and we're trying to buy enough PPE for the rest of the year, and hopefully and potentially for the virus that comes next after COVID. We're also looking to buy a stockpile facility so we can be better prepared here in this area. We're using some of the money for economic recovery. As we know, a lot of our individuals and businesses were tremendously affected by the shutdown, by COVID. And so we're putting out some of this money to the rural residents that need assistance with rental and mortgage needs. We're also putting it out there for rural businesses. And why rural? The question comes up, well, why are we only looking at the rural residents? Well, the reason is that the cities wanted to have their own recovery programs. So each city got some money, some CARES monies, and they're running their own programs from the cities. That's why we're looking to the rural population, which is our responsibility, which is our main responsibility. We have a responsibility to everybody, but since the cities wanted some of the CARES monies, they decided to run some of their own recovery programs. We also are working on a Wi-Fi program that will benefit 27,000 kids that live in the most densely populated areas with no access. And so that'll help them. If we don't go back to school, if they have to learn from home, we're gonna help up to 27,000 kids. We would have liked to have helped more, but because we only have a few months to institute this program, we did only what we thought we could do. We're also gonna light up 4 parks, 1 for each precinct, so that if you don't have access to internet, we're gonna give you at least 1 additional access. We've invested in testing. We're working tremendously with UTRGV. We put some money out there, and we continue to work with them to get as much testing out to our community. We're also setting some money aside in case there's a vaccine. If a vaccine were to come out, we want to be ready for that. We want to be prepared to give out the vaccine. And lastly, like the judge has said, the hospitals have come to us with their tremendous need, and we have to be there. The purpose of this money is to help the hospitals, especially with capacity issues that they have. And so we're also using the CARES money to help hospitals with their capacity. Thank you for the opportunity, Judge.
Thank you, Commissioner. Very, very well said. You know, you can ask 100 people, 1,000 people, 10 people, you know, what would you do with certain things? You're going to get different sets of opinions. When the Commissioners Court sat down together to decide how we wanted to allocate the funds that we received, we wanted to have a balance. We wanted to make sure that we were going to reimburse ourselves and all of the cities for the expenses they had already incurred because of COVID-19. That was number one priority. The second thing we wanted to do is we found out through our health department, our Office of Emergency Management, that there were some assets that we needed, things that we didn't have. We didn't have facilities to store things. We didn't have supply of certain things. So we wanted to make sure that we would be able to get these assets to be able to provide services. One of the biggest complaints that we got is, where do I get tested? Why can I get tested? Why is it taking so long? We were having to send our testing to labs in Austin or in Harlingen, somewhere else. So testing and laboratory work was very important to us. So we allocated some funds for that purpose. As Commissioner Cantu said, you know, we realized the strain and the hardship that individuals that lost their job, businesses that had to close, the financial hardship that they suffered because of the restrictions that we placed on them. But you know, I hope that they realized that because of the success that we had, because on May the 1st, we had, I think, 3 people in ICU and less than 10 people in the hospitals. And we were having almost single digits of people with testing positive. So we thought we did a pretty good job because of the sacrifices that the people did at that time. But we also learned from a lot of the superintendents. They came across and said, hey, and I think a big reason for the success that we had is that they closed the schools, because we have found out over the period of time, and we got Dr. Melendez that's still here that can comment to that, is the density of people is a big contributor to the spreading. So when they closed the schools, that was a big contribution for us slowing down the spreading of this disease. Well, guess what? Without having distant learning for some of the kids in the rural area, and remember, 1/3 of our people that live in Hidalgo County live in the rural areas. And if they don't have access, to that they can't learn from a distance. The other thing is that a lot of the people that live in the rural areas are elderly. Transportation is a problem to get the elderly to come over for healthcare, because all the healthcare is usually found in more dense areas, in urban areas. So for them to have ability for telemedicine also is very important. So we thought it was the right thing to do, to invest part of these funds in those things. So I hope that when the days are over and we come back and we think about what the Commissioners Court of Hidalgo County did, I hope that we bring a smile to everybody, because I'm particularly proud of what we did. I'm particularly proud of my commissioners and the wisdom that they've used to make these tough decisions. There is no right answer. There is no book of wisdom. We're all learning from this process. Dr. Melendez said that we know much more today how to deal with this virus than we did 2.5 months ago. So anyway, we wanted to bring this information to you to tell you that you're under control. You're the one that can help us slow down the spreading by the actions that you take. And we ask simple things. Stay away from another person's at least 6 feet. If you have to get close to someone, wear facial covering. Be respectful and take self-control of yourself, and we'll come out ahead. So with that, I believe that concludes all the information that we wanted to share with you. But I'll ask all the members that spoke today if they have any last comments that they would like to make before we turn it over for questions. Okay. Well, Jackie, do we have any questions from anyone in the audience?
No, we do not, Judge. Everything was answered.
Perfect. Well, listen, well, that concludes our updates. And thank you very much for joining us.
Thank you. God bless.
Thank you.